Well, let's narrow in now on matters healthcare. And the Kenya Kwanza Coalition has pledged to create the National Fund for Chronic Illnesses as part of its health manifesto. Now, this particular fund will be established to help offset the often hefty costs of treating diseases like cancer, diabetes, and the management during a pandemic. Now, this is just one of the commitments contained in the manifesto that will address the health sector.
Kenya Kwanza's plan for the health sector in Kenya includes building on the already existing universal health coverage system and bettering it by regulating charges at public, faith-based and private healthcare facilities by promoting fully publicly financed primary health care. It will also make health insurance a mandatory requirement, with NHIF as the primary insurance complemented by private insurance as a secondary cover. NHIF contributions will change from individual to household level.
We have committed to the people of Kenya that we will have a universal health insurance that will make sure that every Kenyan will go to hospital and they will walk away without paying a penny.
Kenya Kwanza says it will also create a fund that will help cover chronic and catastrophic illnesses and injuries that are usually exempt from insurance cover. It will enact policies that will enable members of the public seeking treatment at private and faith-based facilities benefit from the public funding that only goes to public facilities by delinking financing of primary health care from public resources. To further lower the cost of accessing healthcare, the Kenya Kwanza administration, if it wins, says it will encourage local manufacturers to competitively produce medical supplies with the aim of becoming a regional pharmaceutical manufacturing hub. This is besides working towards the establishment of a fund for informal traders to help them access medical healthcare.
Recommending as Kenya Kwanza that the same model that involves stakeholders, we are going to bring private hospitals, we're going to bring public hospitals, we are going to bring other players, and we purchase drugs for Kenya collectively so that we eliminate all matters to do with transparency and we avoid the problems in Kemsa.
Issues of healthcare human resource will also be catered for under the Kenya Kwanza government, which says it will work towards establishing the Health Service Commission, besides matching the county government's stipend paid to community health workers. Kenya Kwanza has also pledged to revolutionize patients' records management through the acquisition of the state-of-the-art integrated information management system that will enable Kenyans to own and control access to their records.
You don't have to write on paper every time, and you don't have to go for MRI here, and then you go to another hospital, you do another MRI. It should be possible to make that MRI that was done in this hospital available in the next hospital, because we have that will also assist us in making sure that we have information on the health of our country and how many people are in what category and what do we need to do, and even what kind of drugs we need to keep on our shelves.
Kenya Kwanza maintains that the success of its healthcare programs, whose total expenditure stands at 550 billion shillings per year, will be dependent on how well it will reform the NHIF, making it a credible, trusted institution that Kenyans will feel confident enough to keep putting their money in.
Protocol officers na ushers.
Brenda Wanga, Citizen TV, Nairobi.